Currently, more than 1.1 billion women around the world are experiencing menopause or will enter this stage in the next decade, a stage marked by significant changes in the body that are often overlooked or mistaken for stress and aging. In this video, we will examine 14 scientific signs of menopause, detailing each symptom, and at the end, we will provide practical and evidence-based solutions for managing this period. 1. Hot flashes. Hot flashes are one of the most common symptoms. Many women, especially during the perimenopausal transition, experience them. A sudden feeling of heat in the face, neck, or chest, sometimes accompanied by sweating, heart palpitations, and mild anxiety, occurs. The main cause is a sudden drop in estrogen levels, which stimulates the body's temperature regulation center in the hypothalamus. Wearing cotton clothing, ensuring proper ventilation in the bedroom, and avoiding spicy foods or caffeine can help reduce their severity. According to a study in the Journal of Women's Health in 2023, over 75% of women in the early stages of menopause report experiencing hot flashes. 2. Night sweats. Night sweats are a type of hot flash that occurs during sleep and may lead to frequent awakenings and restless sleep. Many women experience this without knowing a clear reason. A decrease in estrogen disrupts the body's thermostat. Keeping the sleep environment cool, using cotton sheets, and drinking enough water throughout the day can be effective. According to a report from the Mayo Clinic, 2022, night sweats are one of the prominent symptoms related to hormonal fluctuations during menopause. 3. Sleep disturbances. Sleep disturbances such as waking up in the middle of the night, difficulty falling asleep, or shallow sleep are frequently reported during this period. A decrease in progesterone, which is a calming hormone, may be one of the causes. Maintaining good sleep hygiene, limiting blue light exposure before bed, and using melatonin for a short term if necessary are recommended. A study in Sleep Medicine Reviews, 2024, found that over 60% of women in menopause experience sleep disturbances. Mood swings. Mood swings, including irritability, unexplained crying, anxiety, or even mild episodes of depression, are common symptoms. Estrogen plays a vital role in regulating mood by influencing key brain chemicals such as serotonin and dopamine. When estrogen drops, the brain's ability to maintain emotional balance becomes disrupted, making reactions to everyday stress feel more intense or unpredictable. These mood swings are not imagined, they're deeply connected to your body's changing chemistry. 5. Decreased libido. Decreased libido may be due to hormonal changes, vaginal dryness, anxiety, or general fatigue. The use of water-based lubricants, estrogen topical creams, and, in specific cases, sexual counseling is recommended. According to studies from the Cleveland Clinic, 2023, changes in sexual desire are observed in more than half of menopausal women. Estrogen helps maintain vaginal blood flow, elasticity, and natural lubrication, while testosterone influences libido. When both hormones decline, physical sensation and mental arousal may diminish. Even if emotional intimacy is still present, the body's physical readiness for sex often changes, which can be confusing or frustrating without understanding the underlying cause. 6. Chronic fatigue. Persistent tiredness, even after sleeping well, can be linked to hormonal shifts. Estrogen supports the body's energy systems by helping cells produce ADP, the fuel used for daily activity. When hormone levels drop, energy production can slow, leading to a deep sense of fatigue. Add in disrupted sleep, mood fluctuations, or nutritional deficiencies, and it becomes clear why energy levels may not bounce back the way they used to. According to a study in BMJ Open, 2023, chronic fatigue in menopausal women is associated with sleep disorders, iron deficiency, and anxiety. 7. Hair thinning or loss. Changes in hair thickness or increased shedding are often linked to reduced estrogen levels. Estrogen helps keep hair in the growth phase longer and supports the health of follicles. As levels fall, more follicles shift into the resting phase, resulting in thinner strands and more noticeable hair loss. In addition, a relative rise in androgens, male-type hormones, can further shrink hair follicles, especially at the crown or front of the scalp. According to an article in Dermatologic Clinics, 2024, changes in sex hormones are one of the main reasons for menopause-related hair loss. Dry skin. Dryness, irritation, and increased sensitivity in the skin can be the result of hormonal changes. Estrogen helps retain moisture by stimulating the production of collagen, sebum, and natural hydrators like hyaluronic acid. With less estrogen, the skin's outer layer becomes thinner and less effective at holding in moisture. This can lead to flakiness, dullness, and fine lines that weren't there before. A study in the International Journal of Dermatology, 2022, found that dry skin occurs in 55% of women after menopause. 9. Heart palpitations. Unexpected fluttering or rapid heartbeats can feel alarming but are often linked to hormonal changes. Estrogen helps regulate the autonomic nervous system, keeping heart rate and rhythm stable. When estrogen drops, the sympathetic nervous system, the body's stress response system, can become overactive, leading to a pounding or irregular heartbeat. These sensations are usually harmless but very real, and worth mentioning to your doctor if they persist. According to the American Heart Association, AHA, 2023, decreased estrogen can affect the cardiovascular system. 10. Irregular periods. Irregular menstruation, fluctuations in menstrual cycles, including longer or shorter durations, irregular bleeding, or spotting, are among the first signs of menopausal changes. Estrogen and progesterone are no longer being produced on a consistent schedule, and as a result, the body's communication with the ovaries becomes erratic. Follicle-stimulating hormone, FSH, and luteinizing hormone, LH, levels fluctuate, leading to unpredictable ovulation and bleeding patterns. This is your body's natural process of slowing down reproductive activity. A study from the NIH, 2023, showed that most women experience irregular periods for 2 to 8 years before menopause. 11. Decreased bone density. Bone health is deeply tied to estrogen, which slows bone breakdown and supports calcium absorption. Without estrogen's protective effect, the cells that break down bone, osteoclasts, become more active, while bone-building cells, osteoblasts, slow down. Over time, this shift can lead to bone thinning, putting you at greater risk for fractures, especially in the spine, hips, and wrists. According to a report from the World Health Organization, the risk of bone fractures in women after menopause increases up to twice. 12. Urinary problems. Frequent urges to urinate or mild leakage when laughing or coughing may be linked to hormonal shifts. Estrogen supports the strength and tone of the bladder, urethra, and surrounding tissues. When levels drop, these tissues become thinner and weaker, leading to reduced control and sensation. This group of changes is now understood as part of genitourinary syndrome of menopause, GSM, a treatable condition with both lifestyle and medical solutions. 13. Joint and muscle pain. Aching joints and stiffness may increase as estrogen declines. This hormone helps manage inflammation and supports collagen production, which keeps joints and muscles supple. With lower estrogen, the body becomes more susceptible to low-grade inflammation, and tissues lose flexibility. This combination can lead to discomfort in the knees, shoulders, and lower back, particularly after rest or inactivity. A study in Menopause International, 2022, found that 40% of women in menopause complain of joint pain. 14. Headaches and migraines. Hormonal changes, especially fluctuations in estrogen, can exacerbate headache patterns or trigger new migraines. These headaches often have a history before or during menstruation but may increase in frequency and intensity during menopause. Stress management, maintaining a regular sleep schedule, and, if necessary, consulting for medication treatments such as migraine medications are suggested. According to a study in Cephalalgia, 2021, 58% of women reported an increase in headache frequency during menopause. Scientific and practical strategies for managing menopause. Hormone replacement therapy, HRT, is an effective method for reducing symptoms such as hot flashes, sleep disturbances, and osteoporosis. Various forms, including oral, topical, or vaginal, are chosen based on individual conditions. However, it should be administered under a doctor's supervision, and evaluations such as mammograms or blood tests should be conducted before starting. For those who do not wish to or cannot use HRT, non-hormonal medications like fluoxetine, venlafaxine, gabapentin, or clonidine can be suitable options for managing symptoms such as hot flashes or anxiety. Nutritional supplements also play an important role. Calcium, vitamin D, iron if needed, and omega-3 are recommended for bone health, mood, and heart health. Plant isoflavones, with their estrogen-like effects, can also be beneficial. Physical activity should become a part of one's lifestyle. Aerobic exercises, resistance training, and pelvic floor exercises each have specific roles in improving symptoms. Vaginal care should not be overlooked. Regular use of moisturizers, water-based lubricants, and in specific cases, vaginal probiotics, helps maintain the health of the mucosa and natural flora. Weight management and maintaining metabolic health are very important. It is recommended to adjust the diet, reduce the intake of simple sugars, manage stress, and regularly monitor weight. Finally, regular checkups such as bone density scans, blood tests, and relevant imaging like mammograms or pap smears are essential. Knowledge truly can save lives, and sharing it may save even more. If you found this information valuable, please give it a thumbs up and subscribe to our channel for more life-saving content. Your support helps us spread awareness and empower more people to take charge of their health. Thank you for watching.